Hi there, it's a pleasure to meet you. My name is Dr. Lacrosse. I'm going to be conducting your cranial nerve examination today. Yes. May I just start by taking your full name? Thank you. And are you aware of what a cranial nerve examination is? Yes. Okay. So we have your full consent to conduct the exam. Fabulous. Could you just confirm your full address as well for me? Okay. Fantastic. Now we'll conduct the exam as you are now in a seated position. And as I am aware, a nurse has already been around to take your vitals, so your blood pressure, heart rate, O2 levels. That's all been done. Fabulous. So we can get started with the exam straight away. Okay, I do just need to grab a little checklist as there are a number of things we are going to be testing on you today. Yes. I do want to have a little look at you just to begin with, just to see that there are no obvious deformities, discolorations in the skin colour, temperature as well. So I am just going to start from the head. I'm going to feel the skin just to have a little look. I will also take a little peek in your scalp here. You don't have any issues with dandruff or... No? Okay. No, I don't see any redness. That's fine, so just feeling both sides of the face. Just going to feel down your arm here, just along your chest where your collarbone rests. Excuse me, I'm just moving your arm around, checking for any redness. You do have a couple of moles. None of them seem to be of any concern, but have you had your moles checked before? You haven't? I may just note that down, as it is something I probably would recommend in the future. Are you someone that has a lot of exposure to sun? And you haven't noticed any skin colour changes or swelling? No? Do you have any scars at all that may be in areas that aren't exposed at the moment? Would you like me to take a little look at that? Yeah, if you just lift your top up for me, I will just take a very quick look just to ensure. I'm just going to feel over the skin. There's no tenderness at all. Yeah, that looks fine to me. Yeah, I wouldn't be worried about that. Okay, now how is your sense of smell? Okay, you think? I am just going to place a cotton tip under your nose which has been soaked in a solution. Can you hold one of your nostrils for me? Okay, and if you smell this. Yes, now if you swap nostrils. Fabulous. I am going to take a very quick peek inside your nose just to ensure there's no abrasions, no deviation in the septum, but what I do just want to do very quickly is if I hold a finger to your nostril, can you blow? And then the other side. Good. So I will just place my finger on the tip of your nose here and just take a very quick look inside. Thank you. Alright, now I can see you are not wearing glasses, so we don't need to worry about that. What I do want to begin by doing is the tests which do not involve the use of the light, just because it can have an effect on the outcome of the other exams. Now I am going to begin by holding two fingers up like this. I need you to look at my nose, at my forehead, whatever it is you want to look at, on my face, and I will wiggle a finger and you tell me which one it is. So I do need you to respond out loud as to which one, okay? So yes, look at me. So just to change up the exam slightly, I am going to bring my fingers closer to your face, but slightly further apart so they are at the edge of your peripheral vision. So you tell me when they are at the edge of your peripheral. Okay. So once again, you say out loud, left or right. Perfect. Now I am going to ask you to follow my finger with your eyes. Do not use your head, just your eyes. Is there any discomfort in your eyes when you are doing that movement? No. Okay, I do just want to test your pupil's reaction to light now. I am going to turn the lights off. Okay, fabulous. So we'll just turn. I will begin by just bringing the light in and out, testing the dilation there, and the other eye here. Excuse me there. Now I'm going to hold my hand in the middle of your face. I will shine the light in one eye and check the other just to ensure that is okay. Alright, now if you could close your eyes for me, what I'm going to do is shine the light over your eyelids, and I need you to tell me if you can recognize when the light is on you. Okay, so close your eyes and you tell me when you can see the light. Okay, that's great. Now I can turn the light on again. Just going to ask you to look either left, right, up or down. Okay, so if you can look to your left for me. Okay, now if you look to the right. if you can look up. Then if you can look down, but what I am going to do is just pull down on your lower lid. So do just relax. And the other eye. Just keep looking down for me. Thank you. Okay. I'm just going to test the sense of feeling in your face. Once I've done that, I am going to go down the body. I just want to make sure that both sides are equal, so I am just going to pat on the skin either side. You just give me a verbal cue that it is equal, okay? And the neck here. Perfect. Just going to pat along your shoulders. Okay, and now your arms, which are also exposed, okay? And if you can just pop your hands, palms up. It's the same. Good. I'm just going to squeeze on the tips of each of your fingers. So I am testing the capillary refill, but also you tell me that it is the same, okay? The same. Perfect. Just whilst we are here, I am going to ask you to do a couple of different facial expressions. So I would like you to raise your eyebrows, so make a surprised expression. Okay, now furrow your brow so you're really angry. Can you do a big smile? Are you able to smile with your teeth? Good, and then can you blow your cheeks out? Good. Now what I'm going to do is just feel your jaw, and I am going to ask you to just clench, okay? So just clench really nice and tight for me. Okay, now I am just going to ask that you open your mouth and don't allow me to shut it, okay? So mouth open and don't let me close it, don't let me close it. Good. Now I want you to furrow your brows again, and I'm going to ask that you don't let me raise them, okay? So don't let me raise your eyebrows. Okay, I'm going to ask that you close your eyes really nice and tight and don't let me open them. That's great, well done. Facial muscles are all okay. Now with your tongue, can you press it into both of your cheeks? Good. Can you stick your tongue out for me and say ah? Thank you. Just checking oral health is okay. Can you put your tongue to the roof of your mouth? Okay, all good. How is the mobility in your neck? Okay, are you able to turn your head all the way, both ways? And how about up and down? Perfect. Yeah, we're whizzing through this. Okay, just before we make our way down your body, I'm just going to test your hearing. Now I'm going to make some soft sounds beside your ears, and I need you to tell me which one it is. Okay, so you close your eyes for this. Fabulous. And again, this is what the soft sound will sound like, okay? Alright. Good. So you tell me which side, left or right. Okay, good. Okay. Can you outstretch your arms in front of you like so? And I just need you to hold them there and close your eyes. So keep holding them there. I am just going to tap on your arms and I need you to just keep them up, okay? Good, you can open your eyes now and put your arms down. I'm going to place my hands on your shoulders. I'm going to push down and you're going to resist my push, so you keep them. Alright. Fabulous. Can you bring your arms up into this position for me? Now I am going to hold you at your forearm and I'm going to try and pull your arms out from your chest like this, okay? Yes, so you keep them nice and tight, locked to your chest. Good, and the other side here. Okay, from this position, can you move your arms like this? So just your hands placed on top of one another. I'm going to place my hands on top and push down and you keep them up. Good. Sorry to be awkward. I need you to just pop your arms straight out again for me. Now instead of that tapping, I am going to be pushing down. You keep your arms up. Okay. Good. Fantastic. Next thing I do want you to do is touch your nose and then touch my finger, which I'm just going to hold here. So you're just going to continue doing that same motion and I will move my finger between each tap, okay? So tap your nose, tap my finger, 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 tap your nose, tap my finger. I am just going to ask you to stiffen your wrists so they are like this, and I am going to try and bend them back to being straight. Same with your fingers. Really stiffen your fingers out and don't let me bend them. Good. Okay, what do we have next? Yes, we are going to hold hands. So like it would be like this. So we'll cross hands like this. Yeah. And I need you to squeeze my hands as tight as you can. Don't worry about hurting me. Okay, good. Okay, now are you able to lift your knees up? Good. Now I'm going to ask you to lift your knees up again, and I'm going to push down on them, and you're going to do your best to resist. You are allowed to pop your hands back onto the bed just to stabilise yourself a little bit. Okay, so we'll push down, push down. Good. I'm going to, in the same way that I held your forearm, I'm going to take your calf and I'm going to try and pull it away from the bed, and you're going to try and keep it tucked nicely against the bed there, okay? Okay. Alrighty, you are doing absolutely fabulously. Now I am just going to do excuse me, I am just going to do a test of your reflexes. So I am going to use a small mallet. So I am going to begin with your elbows. Yeah, so if you can hold your arm like nice and limp for me, I am going to support just under your bicep here. Okay. Good. And we'll swap arms, so we'll do this one now. So again, I support under the bicep, you allow your arm to go loose. Fabulous. Now just do your wrists here. So again, allow your wrist to go loose. Okay, and this side. Fabulous. Now just moving down to your knee. Okay, so I'm going to support the back of your thigh here. Good. And then lastly your ankles. So I'll support the back of your ankle here. Okay, and the other leg. Good. Now, this is a little bit of an odd one. I'm going to try and ask you to not blink. So if you look ahead, it may be easier for you not to look at me. If you want to just look at the wall behind, I am going to tap your face in a couple of different areas. So it will be more of a percussion type tapping. So I will place a finger on your face and tap over the top. But I need you to try not to blink. Do you suffer with dry eyes or anything at all? Not that you're aware of. Okay, well, we'll do our best. So you just focus on the wall behind. Very good. Then we're going to do dull or sharp. Now, sharp isn't actually sharp, so don't panic. It is simply just the metal tip of my pen. And the dull is going to be a cotton tip. So I will show you what each of them feels like. Excuse me. So this would be soft. And that's going to be sharp. So close your eyes and you tell me which one it is you are feeling. going to move off your face and onto your neck. Good. Now we're just going to move on to your arms here. Just making sure we have done everything here. The only thing I may ask you to do is a quick check of your speech. Now you have been verbal with me today, but if you can just say the words light, tight, dynamite. Then if you can say can you say ooh? Can you say e? Fine. Done all of those. Down the corneal reflex. We haven't done the what's called a jaw jerk, but I don't think we need to do that for you, so that's okay. Speech done. I'm just going to hand you a small plastic cup of water, and I do want you to simply just drink the water. That's all I'm looking at, and I'm just going to make a visual check to begin with. Then I am going to place my hands on your throat and feel. So if I give you this, if you just take a nice big gulp for me. Okay, now take another big sip again, and I am just going to feel I'll take that back from you. Okay, we've done that one. Another speech one. Can you say yellow lorry for me? Yellow lorry. Yeah, like Lorry. Lima, Oscar, Romeo, Romeo, Yankee, lorry. Okay, good. Right, I think that is pretty much all we need to do for you today. We didn't do quite as an invasive or comprehensive exam as you can get in a cranial nerve examination, but you do come to these appointments regularly. We can see from your past results and from the beginning of the exam that everything pretty much seems okay. You've not had any head injuries or any injuries at all in the last 6 months. No, you've been feeling fit and well in yourself. Yeah, and you haven't had any concerns at all that you feel that you should bring up to me today. Okay, well that is everything. Thank you for coming in today. It's a pleasure seeing you as always, and I do hope you continue to stay fit and well. No trouble at all. Take care now.